Thank you for joining us today and welcome to ALD Career Conversations. So last year, ALD updated our tagline to taking you from first year to career. And this series looks to do that. It looks to explore the path between your first year and your career. So we're grateful to have alumni like Julia here to help us. And we're very thrilled to see so many students on the call today. So at the end of the call, or at the end of the question and answer session, you'll have a chance to turn on your microphone and or type a question in the chat. So we'll get started with some introductions. Facilitating today with me is Eileen Merberg. Eileen, do you want to introduce yourself?
Sure. Hi, everyone. My name is Eileen Merberg, Executive Director of Alpha Lambda Delta here in the national office in upstate New York. Glad to see you all here. Welcome. And thank you, Julia.
Thank you.
And I'm Trish Maxwell. I'm the Director of Communications here for Alpha Lambda Delta. I work with Eileen in the national office. And I'd like to introduce our speakers. So Julia Steffen Martin was inducted into ALD in 2013 at Northern Kentucky University. She received her bachelor's in Spanish and biology and then went on to earn her doctorate of physical therapy from the University of Cincinnati. So while she was there, she also was, I think, a two-time graduate fellowship winner for Alpha Lambda Delta. And she currently resides in Tucson, Arizona, where she's a pediatrics physical therapist at the Tucson Medical Center. So hi, Julia, welcome. We're gonna get started by asking a couple of teaser questions. So if you could only eat one meal for the rest of your life, what would it be?
It would be some sort of fancy salmon dish that was loaded in butter.
Yum. Okay. If you won an all expenses paid 7-day vacation, and we'll pretend that it's that COVID never existed or we're past it and everything's safe, 7 days paid, where would you go?
Well, I guess I'll go to Europe, even though that probably wastes a couple days traveling, but do a little tour of a few countries in Europe.
Great. Sounds good.
And what did you want to be when you were younger?
When I was younger, I actually wanted to be a dental hygienist. I had a really cool aunt and she was a dental hygienist, so I wanted to be just like her. But probably though, when I was a first grader is when I started wanting to be a physical therapist. So I always kind of knew pretty early on, even still, that I knew I wanted to be a physical therapist.
Great. Okay, so let's jump into some questions. And I'm going to start with a little bit about Alpha Lambda Delta. So what role, if any, did Alpha Lambda Delta play in your undergraduate experience? Were you involved, or did you maybe just join for the recognition? And did it give you any skills or anything that might be relevant to your career or helpful for other ALD members to know about?
Sure. So when I was in college, I was pretty similar to the kind of student I was in high school, and that was the student that did everything. I was in every club. I did every sport. I didn't do sports in college, but in college, though, I just joined every single honor society, every single, biology club, Spanish club. So, of course, I was invited to join Alpha Lambda Delta, and it was just another honor society on my long list. But what I realized was unique about, Alpha Lambda Delta was that since it's more geared towards younger students and you're initiated earlier on in your college career, it kind of allowed for more leadership opportunities as a younger student in my college career. So with that, even though I was in other clubs, I was just the young freshman. But with Alpha Lambda Delta, you were able to take on a leadership role or have a more active presence in the club. So I was actually the president my freshman year. And my chapter at Northern Kentucky University was relatively new when I was a freshman. I almost want to say that my freshman year might have been the first year that we had ALD at my college. But with all of that, even though I joined every single club, I did kind of find myself in more of a leadership position with Alpha Lambda Delta. So though I may have joined for the recognition, it turned out to be, more of an opportunity to put a little bit more on that resume and show a little bit more experience and devotion to the club rather than just being a member. But I definitely feel that my leadership skills and confidence grew with being in that club early on in my academic career. And then with that being said, I felt that that made me pretty competitive for some of the scholarship opportunities that are available with ALD. So that was wonderful to have those opportunities as well, due to kind of maybe my involvement in the club and then overall academic success kind of contributing to have those opportunities as well. But what I would say kind of overall with ALD is being recognized early on in your like academic career. I felt like it kind of just gave you a little bit of a push to kind of keep going, keep working hard, having that recognition early on, the first of your 4 or 5 years of college. But that's kind of how I feel like my journey in ALD went.
Awesome. Thank you for sharing.
Mhm.
Can you talk a little bit about your academic majors and the academic experiences that you had, and how did that prepare you for your career?
Sure. So I pretty much knew I wanted to be a physical therapist. However, I didn't necessarily rule out other careers when I started college. So with that, a lot of physical therapists have very different bachelor's degrees. They might have been athletic trainers. You can be an art major and become a physical therapist. You just have to take your core classes. But in my personal experience, I wanted to kind of keep myself open to other medical professions, which is why I chose a biology degree. In case I did change my mind and decide instead to apply to medical school. But that's the reason behind my biology degree. And then as far as Spanish, I was, took Spanish throughout high school. I've never been fluent. I'm still not fluent, but I just enjoyed taking the classes, and somehow I have a bachelor's degree in Spanish. But I feel like even though I'm not fluent, it is still a tool that I can use in my career now. It's not pretty, but it's kind of neat to be able to use it with my families, even though there are times that I still use an interpreter. But I can kind of pick and choose if I feel comfortable, doing a few little simple conversations with a family. Just because in my career, I have worked professionally in New Mexico and Arizona, and that's very different from where I'm from in Kentucky. There's a lot more native speakers in Arizona where I work now, and in New Mexico where I worked last year. But that's kind of how I went about my undergraduate career, and kind of picking a career that's relative to my graduate goals, and also kind of just my personal interests with the Spanish. And then obviously, if you do want to become a physical therapist, the current standard is a doctorate degree. It has evolved over the years. In the last 20 to 25 years, I'd say it's kind of evolved from a bachelor's to a master's to now a doctoral program. So that's just the standard progression to becoming a physical therapist. But the nice thing is with your undergraduate degree, you do have more flexibility in what you want to focus on before you get to that graduate program.
Wow, great. Just to clarify, and this might come up later, but I'm going to ask it now. So inherent in the position of a physical therapist is a doctorate. Like you can't be a physical therapist without it. I don't know much about the field.
If you're a new professional like myself, or somebody who's currently going to college, yes, you do have to get that doctoral degree. However, if you're a physical therapist who's been in practice for 20 or 30 years, you do not go back to school. But right now who's wanting to become a physical therapist does have to go through a doctoral program. I believe every single program has finally made that transition. One or two that in the last few years has made that last little transition from a master's to a doctoral. But as far as I'm aware, it's solely doctoral at this point.
Interesting. Yeah. Okay, so my question, I think you've touched on quite a bit already, so I'll just sort of ask if there's anything you wanted to add in terms of your experiences. So it's related to your path again, from first year to your career. So you've talked about your major and your different academic interests and getting involved in ALD. But is there anything more to describe your path, like as an undergraduate, what led to your actual career, to your job, or what helped, I guess? And some examples might be internships or research or jobs that you had as an undergraduate. Again, knowing our audience here, I'm going to assume are all looking to get into the physical therapy field. Are there things they should be, or what helped you that might help them?
Sure. What I always tell people is that when I was in college, I focused on being a student, but with that, I still had a job. I still was able to make money. It's just I was kind of, I guess, strategic in the jobs that I applied for. So I worked as a tutor on campus and was able to kind of focus in on those biology, chemistry classes, tutoring students, making money, but it also was kind of a resume builder because I learned skills like how to educate a person. And that translates to my career now because that's what I have to do with my patients and their parents because I work with the pediatric population. It's one thing to just treat the patient, but you have to educate them and help them, invest in their health and their progress as well. So I kind of took that approach with my jobs and making money in college, trying to find something that gives you a translatable skill to what your goal is and what your future profession is. I also was able to work in research in a biology lab. Now this wasn't quite related to the field of physical therapy. I worked in a mouse lab. Nothing that was related to therapy, but it was related to my major, and it was an educational experience that I again was able to make money, and it was my job, but it was teaching me more about education and skills, as opposed to maybe other jobs out in the community. So I would say that's one thing, was the jobs that I had. And then ultimately as a senior in college, I did get a job as a physical therapy, I guess tech is what they call them. So it wasn't the most glamorous job. I cleaned tables, I changed pillowcases, and it wasn't like very fun, but it, again, it was something to kind of show that I had interest in my career. I'm around physical therapists, I could ask questions while I was, making money again, but adding it to my resume as a good experience. I will say that something I would give advice on is I say that I wasn't really interested in that job as a tech. All along, I kind of knew I wanted to do pediatrics, and I was in a very sports clinic. So it just wasn't in line with my interests in physical therapy. But that was something that I had to kind of get over because I knew that the experience was more worthwhile and I was getting observation hours. And regardless of my interest in that particular field of physical therapy, it kind of just made an overall, I guess, addition to my application as a student to graduate school, and just kind of showing that, hey, I'm invested in the career. This might not be my favorite realm of physical therapy, but that was, again, another way that I used my time and my energy and made money in undergraduate school in preparation for becoming a physical therapist. So ultimately, I just would say trying as hard as you can to find experiences that can contribute to your interest in your future career.
Great. A lot of gems there I want to unpack real quick. That was great. So for everyone listening, so one, great advice just to get a variety of experiences as an undergrad. All your jobs and internships or volunteer opportunities don't all have to be in physical therapy, but get a real well-rounded experience, and you never know what kind of transferable skills there might be. Number two is great advice to sort of, you're not going to walk out of college one day and be the head of a department. So you have to sort of start at a place that that we all have to start at. That might not be the most glamorous, but you want to get in your foot in the door and get in the industry and meet people who have the jobs you want to have someday. So that's great. And then the third thing I would just say is getting experiences, even if it's a part-time job or an internship in an area of physical therapy that you then come to not like at all, is a great lesson, because that sort of helps you process of elimination. Like, okay, I'm working with this population and now I know I don't really want to, so I can focus on something else. So great advice.
And I do just want to add to, like I said, focus on being a student. So my activities and stuff all related to my career, but my ultimate priority was my grades and dedicating myself to my studies, because ultimately you might be passionate about a career or a graduate program, but unfortunately a lot of times it does come down to having the grades and having the GRE score in order to get in. So that was, at the end of the day, that's where my focus really was, but all of my extracurriculars and jobs just kind of added to that.
So let's talk a little bit more about grad school. So you took your GRE. Is that pretty standard across the industry? And then, so I guess, how'd you prepare for grad school? And then what was it like in there? How was it structured? What were the internships, the coursework, stuff like that?
Yes. So the GRE is standard for physical therapy. There's not like medical school is the MCAT. There's not a specific test that you have to take to get into physical therapy school. Usually it's the GRE. And so let's see here. That was a loaded question. I think I forgot it all.
What's graduate school like? What's the coursework like? Do you have practicums or internships?
Okay, perfect. So once you're in graduate school, most physical therapy programs are 3-year programs. I have heard of some that are maybe 2.5. They kind of shave a little bit off somehow, but the standard is a 3-year graduate program. I can talk specifically of how my program was structured. I do know there's a little variety in the structuring of classwork versus clinical experiences, but the way that my schoolwork went was my first entire year, and that included summers, so I didn't get a summer break, and I think that's pretty standard, but my first entire year was all classwork, and then we went out and had one clinical rotation. In my particular program, that was an orthopedic rotation. So again, that's more of your sports therapy, your general physical therapy clinic that probably most people are familiar with, like in the community. So after that first year and first rotation, we came back for more coursework. And then basically my 3rd year of graduate school was 3 more clinical rotations and just 1 more short little segment in the classroom. So my program really heavily puts those hands-on experiences at the end. I do know some programs that mix it out a little bit more throughout the program. But the classwork time, the classroom time, that's structured in both lectures and labs. So a lot of times you might spend, a couple hours getting the notes, getting the lecture from the professor, and then other days you're doing hands-on skills on your classmates. And then we would have written exams, throughout semesters, but then we'd also have a lot of practical exams that were hands-on role playing, where myself and a classmate might go in. I'm the physical therapist, my classmate is the patient, and we're doing specific skills with them. Other times they would make it a little more intimidating, and they would bring in an actor who would be our patient who had a traumatic brain injury. One of our classmates had children, and her little daughter came in and was our pediatric patient for one of our practicals. So those were a little more intimidating because you were comfortable with your classmates and you guys could kind of bounce off each other, but sometimes they'd bring in actors to stump you a little bit. But then that's kind of what the classroom time is like. And then the clinical rotations, that's exactly what it sounds like. It's more of like a job. You're going in for the hours that your supervising therapist is working. So your clinical instructor. So they're just a physical therapist from the community who is willing to spend a little extra time and effort for 9 to 12 weeks to mentor you. And As you go along in the program, you're expected to take on more responsibility with those rotations. So at the beginning, you just kind of are getting your feet wet and might just be treating, 50% of a normal caseload. But by the end, you're expected to kind of be acting as a physical therapist, treating a full caseload while being mentored by your clinical instructor. So that's kind of what those pieces of the puzzle look like as far as rotations and then classroom time with physical therapy school.
Sure. And a quick follow-up. So I know you specialize in pediatrics. Is that like a course? Is that coursework that you take? Is that more experience-based? How do you specialize in different areas?
Yes, so that is also going to vary sometimes school to school. My particular university focused a little bit more on orthopedic classwork, and pediatrics was not a full class that I took in graduate school. It was more just a little bit of information here and there in other classes. Some universities in their physical therapy programs do let you take elective classes. My program was a little smaller. We didn't have electives. So if you're lucky, you might go to a college that has a pediatric elective course. Other specialties that are common in physical therapy that aren't kind of part of the core curriculum would be like women's health is another one. That's a little bit more of a specialty. But in general, your orthopedic patients, your neuro classes, those are all core classes. But like you asked about pediatrics, that's a little bit more of a specialty, like you said. So for me, since my university didn't offer a particular elective course in pediatrics, I had to request to have one of my internships, one of my clinical experiences be in pediatrics. So that's how I got my basic level of pediatric knowledge. And I will say that you learn a lot on the job, and that's kind of expected in physical therapy. When I was hired as a new grad in my first job in pediatrics, they knew that I wasn't an expert and that it's not a focus of pediatric programs. But I feel like physical therapists in general, it's a good community where you're learning a lot from your colleagues. And I've only worked in pediatrics a year and a half or so, but I feel like I have grown a lot, but I still know that there's more growth that I can continue to make in this field. And a lot of it is learning as you go or taking continuing education classes. If you are very interested in a particular field of physical therapy, there is an option to do residencies or fellowships after you graduate from physical therapy school. They're not mandatory. You don't have to do a residency or fellowship to be a pediatric physical therapist, but it is that extra level of education that kind of gets you on a quicker path to becoming more of an expert in a particular field. So that's an option that you can think of closer to the end of your graduate career, or even a couple years into your career, you can still apply for those experiences to really hone in on a particular aspect or area of physical therapy.
Great. So you've given a lot of good advice, but any other advice? So again, and we'll open it up to all of our students to ask questions, but again, assuming they're all interested in the field, given they're all undergraduates, I don't know what year everyone is, but they could be sophomores, juniors, and seniors here. So what advice do you have as they're undergraduates? Any further advice for those pursuing the field?
I would just say to be persistent. It is a long path. If you're a freshman or a sophomore right now, I'm not sure where you guys are in your undergraduate careers, but it is a long path to think about, 4 or 5 years, whatever it might be, of undergraduate degree. And eventually into a program, and knowing you have 3 years of a pretty rigorous graduate program. If I am being honest, it is rigorous. You can always find something harder than this, but this was very hard, let me tell you. But I'm just being honest, that is kind of how it is. But if it's something that you're passionate about and that you're excited about, I think it's worth the effort, and it's worth the tears. I had plenty of tears. But I would just say to be very persistent, and your passion will show through if it's something that you really want. And if it doesn't happen for you the first time around, I would say keep being persistent, because I'm actually on the admissions committee for my university that I went to. So I kind of have read people's applications and read their essays and seen their GRE scores and their GPAs. And, you know, there are patients, not patients, there are students that, you know, they might not get in one year and they go take 1 or 2 classes over again, and they're studying for that GRE, and they apply a second year, and that's the year that it happens for them. So I would say if it's something that you're passionate about, just know that it is a big commitment. It is a lot of hard work, but be persistent and don't give up if that's what you're hoping for your future.
Nice, great. Anything you wish you had done as an undergrad that you didn't? Any sort of missed opportunity, or just something you didn't have time for that you sort of wish you did participate in?
I wish that I was able to find an experience in pediatrics, how I kind of said I had that job in the ortho clinic. I think it would have been really cool if I had the opportunity to work in a pediatric clinic. But sometimes you just kind of, you know, you don't always have every opportunity. So you kind of take the best ones that are presented to you. But that's one thing that I wish was available to me that I could have jumped on.
Great.
Makes sense. So we're going to open it up to the students and see what questions that y'all have.
Hi. So I'm a political science student, but I'm really interested in disability and physical therapy. And so I'm wondering how much math and science is a requirement for your career, and how much do you use it on a daily basis?
Sure. As far as math is concerned, I think I just took general statistics in college. I think that may have been just a gen ed requirement for some PT schools. I was fortunate that I got credit for calculus 1, I think, from high school. So I didn't have to take calculus in college, but I do believe that some programs do want that calculus and maybe a statistics class. So that's kind of the math piece. It's not very intense, I guess, as far as years and years and years of math. As far as like the sciences, I believe that most colleges want that first full year of chemistry and biology. So 2 semesters of bio and 2 semesters of chemistry. I did go on and take organic chemistry, just because, again, I was a biology major, but that was not mandatory for most programs. I will just advise that if you're interested in going to physical therapy school, I would go ahead and look at some of the colleges that you're interested in, because every school has different requirements. So I can speak to psychology. I know that some colleges wanted a certain, 300 level abnormal psychology, like a more advanced class, and other programs didn't. So I would just advise looking at the specific schools as well for what those requirements are, because it's not a standard for every single college. And then as far as your second part of the question, how much I use science and math, I'd say not very much. Just general math, like addition type stuff for some of the special tests that I have to do with pediatric kids. I'd say, the science, it's just more like a building block. I don't use those specific skills, but it might just be more like a science mindset that you have to have sometimes. But yeah, I'd say like in kind of generic terms, you don't really quite use your math and your science on a daily basis. It's just more of like a foundation type thing.
I just want to say thank you. First off, like this is so helpful, everything that you've said. So I'm currently a sophomore. I've shadowed about 3 or 4 physical therapist places already. I love the environment. So I just want to ask, I have 2 questions. So when you were talking about like getting your doctorate, like could you become like a PTA with just your undergrad degree?
Yes, so that's something that if you're interested in being a PTA, I believe that's a specific associate's degree right now. And though it is an associate's degree, it is actually also pretty rigorous, and you need prerequisite classes usually to even get into a PTA program. So I do know that that is, again, kind of a specific degree that not every college is going to offer. So if you happen to know if your college offers it, or if you have to look at kind of a different school, but that is its own separate associate's degree right now. So that's kind of the pathway, I guess, to PTA.
Okay. And then my second question was, so I don't know much about the GRE. So I was wondering like how the scores work and like what's like a good range of score like to get into graduate school, if that makes sense.
I'm kind of blanking on the specific numbers right now, but like I did say, I was kind of on that admissions committee for my school. I want to say that almost like kind of at that average mark for the national level, like that 50th percentile was kind of like our cutoff. So it's not that you needed to be at the 90th percentile or have this super awesome score. They just wanted to see that you were at average or maybe slightly above average in order to get in. I don't want to say any numbers because I could completely be blowing what the scale is for the GRE right now, but I do feel confident in that they didn't expect people to be like at the top end of the scale. So I feel like if you have a solid, average, above average GRE score, that is usually good for most programs. But again, most programs kind of make that information public. And I also wouldn't hesitate to ever reach out to some of these graduate programs and kind of let them know your name, kind of market around with them and show that you're interested, because that kind of can stick with people if you're sending an email and showing interest early on, and maybe taking a tour or things like that. I wouldn't be afraid to reach out and kind of get more of the specifics on some of those things if it's not widely available on their websites.
Okay, I'm actually really glad that you said that because last year, my freshman year, I was like trying to figure out my entire life. I was like, what am I gonna do? And I emailed 10 grad schools last year. So, yeah, I'm glad that you mentioned that. So,
Yes, don't be scared. They want people to come to their schools, and they want people who are passionate about, the field to come to their schools. So don't be afraid to show that interest.
thank you.
That's great advice. I have a question from Tegan. She says, what's the most difficult case you've encountered?
Oh, okay. I would kind of break down difficult into two categories for my career as a physical therapist. One, I would say emotionally difficult, because that's something that you're going to find in a lot of areas of physical therapy, is that you find very sad situations, people who have had horrible injuries or just in very sad circumstances. And I'll say with that you kind of grow in your career to recognize that, yes, it is sad, but as a physical therapist, I'm in a position to improve their situation. So I just will add that bit in there too. The other difficult thing is just straight difficult, just like you can't get anywhere, people aren't progressing, just a difficult case. So I'll start with that one. Just very difficult is a patient that I actually am currently seeing. I'm on a maternity leave right now, so I kind of haven't seen this patient in a while, but I was seeing her up until my son was just born. But she's a young girl, she's a teenager. And I believe when she was an adolescent, I'm not sure exactly how old she was, she had cancer, and everything ultimately just led to very strange hormone imbalances, thyroid issues, just all kinds of body systemic issues that she's really been struggling with. And all of a sudden in the last year, she developed a type of jump where she was walking and she truly jumps or has this skip in her step. And what's interesting about her is, she sees psychology, she sees me, she sees a neurologist, she sees so many people. And I think that's what's a good thing about therapy is you're really never like that one piece of the puzzle that is going to solve something. You really have to realize that you're working with a huge healthcare team for some of these patients. But with this patient, it's been very difficult. And what I've come to realize, it's more of, instead of, working on her strength or her flexibility or something like that, it's for her, it's more working on encouraging her and helping her realize that, let's get her in a positive state where, we're trying to go up the steps and she's crying and scared and says it hurts. And I said to her, why are you crying? You should say, like, I'm strong, I'm brave, I can do this. My body's getting stronger. So I think that's a good example I can think of, as far as sometimes it's not the stretching, it's not the weightlifting, it's not things like that. It's helping people to realize their potential and to be a cheerleader, be a coach, and be a friend to somebody. And sometimes that is what makes the most difference for some of these difficult cases. And then as far as kind of emotionally challenging that I was speaking of, would probably be some of the patients that I've seen who've had traumatic brain injuries or birth injuries. One in particular was in a very bad car crash. She was a little girl, and I was with her in New Mexico, and I still follow her on Facebook, and she's finally walking again, which is great. And then another little boy that I again saw in New Mexico at my last job before I relocated here to Arizona, who had a terrible birth, and he was born healthy, but there were some mistakes that were made that led to not enough oxygen getting to his brain for quite a while. So he has very severe cerebral palsy and very limited abilities with his extremities and lifting his head. So I'd say some of those, again, are the emotionally sad ones where you go home and I'm emotional and I go home and I just want to cry, and it makes you sad. But again, I've learned to kind of build the family up, build the patient up, and find the positives and really focus on the fact that you have the ability to improve their situation, even though it is a sad one.
Great. Another question from Tegan. She said, obviously school costs money. So do you feel that the amount of debt is worth the outcome? And were you able to have a balanced life in grad school, or was it unbalanced, and in what way?
So I will go ahead and preface this with that I am very much in the minority and that I do not have student loans from undergrad or graduate school. I know Trish mentioned that I had received a couple scholarships from ALD. So like I said, I was always focused on being a student and getting good grades and being involved. And with that, I felt like it made me very competitive for scholarships. I applied for scholarship after scholarship after scholarship. And I was fortunate that my university was one of the few that provided a small scholarship as well. Usually for graduate school, or I guess I should say for physical therapy school, there are not many university scholarships. So I was lucky that my university was able to award me one, and I appreciate that so much. So I will say that I'm very much in a different situation than most of my classmates are, where some of them are coming out with undergraduate debt and graduate school debt. I would say, a physical therapist, it's not the world's best salary. It's not, I'm not a doctor making $300,000. I should say a medical doctor making $300,000, it's a good career. It's a nice, salary for my family, but I'm not, making millions over here. So I would say, you just kind of have to balance it in your mind and kind of look at your personal situation and decide kind of what works for you. If you're willing to take on that debt, you're going to pay it off eventually. You're making enough money to pay it off eventually. Own personal situation, see kind of what works best in your given circumstances. But with that being said, I would really encourage, like I did, apply for scholarships and really kind of see what's out there. Because in my case, it made a huge difference. And I am just so fortunate that that's something that I haven't, kind of had lingering along with me, student loans. But that's kind of the advice I would give there. And then there was a second part of that question, wasn't there? Was that it?
I think it was related to balance in grad school.
Oh, yeah.
Did you have, were you juggling? It sounds like you just had a baby. Congratulations. Is that your first? Did you have a kid in grad school? Like, how do you balance personal and other stuff?
I got engaged when I was in my first year of grad school. and I got married right after grad school. So I wasn't married. I didn't have kids. My husband's in the military, so he was actually away most of the time that I was in grad school. For me, I kind of only had grad school to focus on. So I truly do not think that I had a good balance at all. I woke up every day at 6 a.m. I drove straight to school. Truthfully, it was probably dangerous because I was so tired and I was probably falling asleep at the wheel some days. And that is the honest truth. It was dangerous. But I would be at school from about 6:30 a.m. to 6 p.m. studying, going to class, just totally all day. I would come home, eat, study some more. On the weekends, all I did was study. I will say that I was overkill. I do think there's a way to balance it. And I really hope that if you do go to graduate school, or even in your current experiences in undergraduate school, I hope you find a better balance than I did, because it made it much more difficult than it needed to be. But again, I'm probably like a lot of you, I'm that student that you have to have an A, you have to get that 4.0. And even though I did get a 4.0 in PT school, I don't know if it was worth it.
I wonder
So,
about that, like, Bs are probably fine. They're not going to get you that different of a job, right? I mean, it's grad
No.
school, so
No,
yeah,
they're
so
not.
yeah, you don't need, yeah, but that's good advice. Thanks for being
Yeah, I mean,
honest there.
you got to have the grades to get into graduate school.
Yes,
So, there's one thing, but I
yeah,
would say try to find that balance, because it can really get to you.
yeah.
So yeah.
Okay, you want to stay healthy. We just have a few more questions. We're not a whole lot of time left, but let me get in a couple questions in the chat. So we're still in the middle of a pandemic. Hopefully it's coming to an end at some point in our future, but what are some options, given the pandemic, what are some options we can take in order to start some internships or job shadowing if we're not even in person on our college campuses right now?
Oh my goodness, that's a good question, because I do think that, I want to say the hospital I work at, I don't think they're allowing volunteers right now. So that's hard. But again, I think it's that networking type thing. Reach out to all 5 hospitals that are around you, or reach out to every clinic, and just try to find the 1 or 2 that would allow people in right now. Because yeah, I totally see where a lot of people are shutting it down and not letting people come in. But at the same point, I would almost imagine, I'm not sure of this, but maybe check with some of the graduate programs, because they know that students are facing this problem. So I would almost imagine that there's some sort of reduction in observation hours that you might need to accumulate. But again, don't take my word. I would reach out to some of the universities, and maybe see if they know of any clinics that are still partnering with their students or prospective students. Just send those emails out, is what I would say, because it is hard right now, but don't let that discourage you. I would still try to show interest and try to push for those experiences. Because, even if they do not want as many observation hours, you still want to show that, hey, during a pandemic, I was proactive and I still got them, So
Yeah.
try to kind of be in that mindset is what I would recommend.
Good. Quick question back to the GRE. You spoke about, you weren't exactly sure about the scoring, and that's okay though, but so what about preparing for it? Is there any advice, just because it's the general and it's not there's no subject specific GRE, what's the best way to prepare?
I did get a couple books from the library and took many, many practice exams. I actually took the GRE a year earlier than I needed to, because I had a summer that was wide open with nothing to do. So I knew I could focus on studying, taking practice exams, going through questions. And that worked out really well for me, just because I kind of focused on that time in my life where I had a little bit extra time to devote to it. So that worked with my schedule pretty well there.
Yep. And then Caitlin, I think Julia answered your second question, so I'll ask the third, which is opportunities for physical therapists to work specifically with dancers. Do you know anything about that field?
You know what? I do have one classmate that she was like a semi-professional dancer. And I don't think it's very common, but I do know you can find experiences like that. At my university, they had a really good dance program, and one of our teachers was kind of, almost served as more of an athletic trainer for them. But that classmate of mine who was interested in dance collaborated with my teacher to kind of specifically work with dancers. And, that's not, a type of clinic that you're going to find in every city across America, but that would be a great specific career where you might have to travel to a certain area to get in a type of clinic like that does only serve that dance population.
Back to grad school, I think you might have touched on this, but did we talk about this? What types of classes are there in grad school? Like, so you were talking about chemistry and biology and stuff for undergrad, but what are the courses in a PhD program?
Okay, so a wide range. You have your ortho classes where your orthopedic classes where it's specific interventions for your joints and muscles, stretching, strengthening, very specific things that I did not understand or know about when I was an undergraduate student, but I'll just kind of leave it general in orthopedics. And then you have your neurology classes where you are kind of studying the brain and studying the connections of the brain, but then how that looks in patients that have a traumatic brain injury or a spinal cord injury. And so forth. It gets more complicated from there. And then you have other classes where you're practicing very practical skills, like how to transfer a patient from a bed to a chair, or using different, a walk. How do you use a walker, or how do you use crutches? Practical things like that. One of the first classes I took in graduate school was gross anatomy lab. So we did do a full cadaver dissection. That's just something to be aware of based on your level of comfort with that. My program was pretty good. You could kind of take a back seat if you wanted to, but you still had to be there and still had to identify body parts, nerves, muscles, things like that. It was a full dissection. I'm not sure if that's the case for all classes, but that is something, or for all programs, but that is something that at least my program did. But yeah, I'd kind of say that's kind of some of the more general type classes, and then, gets specific from there. But yeah.
Okay, and the last part of Amaya's question was related to graduate assistantships. So I think you touched on that, but are there any in a PhD program?
Okay.
It seems more common in masters.
Yes. So from my experience, I applied to 4 or 5 graduate programs. And the one that I applied to, I only applied to it because it had graduate assistantships. And if you're interested in knowing, that was Ohio University. And so I only applied there hoping to potentially get a graduate assistantship. I did actually was offered one of the graduate assistantships. Ultimately, I did not go to Ohio University. I went to the University of Cincinnati, but I was actually able to use the fact that I was accepted into a graduate assistantship program at that other university. I went to the University of Cincinnati and said, they're offering me this. And that's how I got a scholarship to the University of Cincinnati.
So yeah.
I used it as like leverage. I guess,
yeah.
But what I will say is ultimately I decided not to go to that university with the assistantship because I knew that it would take away my time and that it would be a little more demanding. It's almost like having a little part-time job. So I kind of knew that I didn't want to work, I guess, in graduate school. So for me, I felt more comfortable focusing on my studies. But if you're somebody who needs to have something like that in order to make it financially possible to go to grad school, they're out there. But again, you kind of have to search for them and ask around because very few programs probably have those graduate assistantships.
Okay. So you applied to 4 and got into how many?
4.
4. You got into all 4. Great. Trish?
So Julia, you are, well, I'll say the scholarship guru. So you said you applied for a lot of scholarships and you got them. Where do you find them? What, are there specific websites or resources that can help students find these scholarships?
There are websites out there that you can use, but where I found most of my success was going through the different honor societies and clubs that I was a member of, and going through those opportunities. That's where I had more success in my experiences. But just know that, I mean, there are community scholarships, there's stuff everywhere. You can find kind of search engines. I'm blanking on the names of them, but there are search engines that are specific to scholarships that you can, I'm sure, do a quick Google search and find what those are called. But otherwise, I would say kind of look around at the national societies that you're in, different clubs, and you'll probably find more opportunities than you would expect.
Thank you.
Did we get at what was your, I think the last question, and I think we'll wrap it up, is what was your experience getting your first job after PT school? So how did that path, how did that go from right from grad school to the first job?
This is a good question for me. I've had a very interesting career experience. I graduated in the spring of 2019. I am currently on my 4th full-time job. So I've had a very weird experience. My resume probably looks like garbage to some people, but so when I graduated, like I said, I got married right after grad school. My husband's in the military. So right away we relocated to New Mexico. I don't know anything about New Mexico, but I'm looking for a job. And I knew I kind of wanted to do pediatrics, but I also really like elderly patients. And I find that's common that people like geriatrics and pediatrics because there's a certain level of nurturing, I guess, that you have to provide to both populations. So I got out of school. I couldn't find a pediatric job. There wasn't much available in Albuquerque, New Mexico, where I was at the time. So I took a job in a nursing home. I worked there for maybe 2 months. It was okay. It was very difficult. Nursing homes are a little more demanding in the amount of therapy that they want you to provide. They want you to do a bunch of therapy and get out. They don't want to pay you to sit around and do your notes and do extra things. So it's a little more rigorous, is what I found, just with the management of nursing homes. But ultimately, I was actually laid off from that job because there were Medicare changes that affected compensation of physical therapists. So 3 of the 10 therapists at that nursing home were laid off overnight. It was very sudden. So I was like, oh my gosh, like already, I'm like, this is crazy. So I go again looking for another job, nothing available. I took another job at a nursing home. But wouldn't you know it, my first day at that second nursing home, I was offered a pediatric job. And I just had to take it. So I put in my 2 weeks notice at that second job and I took the pediatrics job. And that was just a blessing. That was such a great job. Unfortunately, military said you got to go to Arizona. So here I am in Arizona now. I applied to my current job right at the beginning of the pandemic. I got in just in the nick of time, but I'm fortunate that I have a job. But yes, that is kind of how I have gone from graduate to, I guess, a physical therapist with 4 jobs within a year and a half. It's been crazy, but I would just kind of say, you know, fight for yourself. And what I've learned is pick a job where you are able to be a therapist that is ethical and makes good decisions and can ultimately provide for your patients and be fulfilled with that job. So that's what I've learned in those experiences.
Julia, thank you so much for all your time. This was great, really great
Thank you.
information. I hope the students got something out of it. Thanks for sharing your time, your advice, your expertise, your experiences. Thank you for being an ALD rock star, member for life. So thank you for everything.